This skill is provides mouth care. You'll wash your hands, knock on the door, check the bed, making sure it's locked and lowered, provide privacy, address the client, and explain procedure.
I'm Mrs. Plunkett. I'm Lucky, and I'm going to be your CNA today. I'm going to go ahead and brush your teeth. Is that okay? I'll go gather my supplies and I'll be right back.
From the linen cart, you will get a towel to cover the bedside table to create a barrier. You'll get a towel to cover the client or a bib. Then you will gather a toothbrush, toothpaste, a cup, a bottle of water, and an emesis basin. You will also need a pair of gloves. You'll assist the client to a sitting position, making sure to touch their shoulder. Ask them to put their feet flat on the floor. You'll go ahead and wash your hands and put on your gloves. You'll cover the client with your chosen clothing protector, whether it's the towel or the bib. You'll go ahead and pour a little bit of water into the cup using your bottle of water. You will wet the toothbrush in the cup of water and apply a small amount of toothpaste. You'll brush all surfaces of the teeth and then brush the tongue. Okay. You may place the toothbrush down. Let the client have some water to rinse with. Holding the basin for them. Okay. Now you remove the clothing protector from the client, making sure to dry their mouth. You will dump from the emesis basin. You will rinse it, dump the rinse water, dry the basin out. You will rinse the toothbrush and then place it in the emesis basin. You'll dump the water from the cup in the bedside commode and throw the cup away. You'll place everything else in the dirty area and then gather your linens and put them in the dirty linen hamper. You'll remove your gloves the proper way. Wash your hands. Return to the client. You can check the bed, making sure it's locked and lowered, and provide privacy. Give the client their call light.
Is there anything else you need before I go? I'll wash my hands. My skill's complete.